Hey guys, Dr. Steph here from Living Health Integrated Medicine, and I want to talk to you about a very important topic and how it's related to a condition called neuropathy. So as many of you know, we see a lot of patients with neuropathy in our office, and we have protocols to help reverse neuropathy. Neuropathy is the death and dying of the nerves, especially the tiny nerves in the feet and the hands, but neuropathy can also affect central digestion and brain function as well. The most common cause for neuropathy is blood sugar dysregulation or diabetes, prediabetes. But the next runner up that we find, and it's actually quite common even in diabetics, but especially in people that have worked with environmental chemicals or have metal in their teeth or have had chemotherapy in the past, is heavy metals, in particular mercury. Very, very, very common as far as its implication with neuropathy. So I wanted to talk to you guys about it today because this is, something that we have to really investigate with people, especially if they have nerve pain or nerve damage. And I wanted to show you some of the research real quickly on how that is actually being verified in the research, how mercury can be a contributing factor to neuropathy. In fact, this paper here in MedLink is literally called Mercury Neuropathy, and published all the way back, originally released in 1999. Crazy enough, we've known this for a while. And they actually talk about in their key points that peripheral neuropathy from mercury exposure most commonly involves the distal sensory nerves. This is the, like I said, the tiny nerves in the feet and the fingers, so your toes and fingers first, with short-term exposure, and then motor with long-term exposure. And long-term exposure could come from eating large mercury-filled fish, like tuna. The larger and the older the fish, the more likely it is to have high levels of heavy metals, especially mercury, but then also metal fillings. So every time, if you have metal fillings in your mouth, they are roughly 50% mercury. Mercury is very volatile. It's liquid at room temperature. So for it to stay solid in your mouth, it's actually quite challenging. And it's mixed with other metals that are harder to try to keep it in a solid form. But it's been found that every time you chew with metal in your mouth, you're actually off-gassing and vaporizing some of that mercury in your fillings, and you're breathing it in and you're swallowing it. And that is a very common source of toxic mercury for people. So chronically over time, if you've got these metal fillings in your head for 10 years, 15 years, 20 years, and you have enough of them and they aren't, holding up well, that could be enough of a chronic exposure that now no longer are you just getting some tingling and some sensory sensation issues in the toes and the feet and the fingers, but maybe now you're starting to lose motor function. So your balance is becoming wonky. You're not able to grip as well. And at that point, you've had this problem going on for quite a while. And so longer term exposures can start to affect motor function as well. And then they say here in the paper that inorganic, so there's two main real kinds of mercury. One is organic, which is something we find mostly in fish. It's attached to carbon. It's really brought into and amalgamated into the tissue. And then inorganic is more something you'd find not in a carbon living situation. So the heavy metal in your teeth, it's more in a salt form, industrial chemicals, you might be breathing them in. As far as that goes. So inorganic and elemental mercury exposures are more likely to cause peripheral nervous system complaints and central nervous system. So in the brain, we find more with the organic. So the fish eating, the food sources can start to actually implicate brain, which can lead to Alzheimer's dementia. So not a very good thing. Another paper here, you can find this on pubmed.gov, is mercury exposure causing diabetes, metabolic syndrome, and insulin resistance? And they actually found to some degree with the review of the literature that it did actually contribute. Obviously, it's not a single cause, but if you have diabetes and you have exposure to mercury and you have neuropathy, This is why all of our neuropathy patients get tested for heavy metals, but anyone can come in and get tested for heavy metals if they feel like they may be getting exposed, have metal in their teeth they're looking to eliminate, as far as that goes, to prevent long-term exposure. Another paper published April 2015 in JAMA, that's the Journal of American Medical Association, called Elevated Blood Mercury Levels in Idiopathic Axonal Neuropathy. So idiopathic is a medical term for we don't know what's causing it, and what they're finding is some of these idiopathic is elevated blood mercury levels, so that can be an issue too. If it's not heavy metals in idiopathic, then very often what we find it's something more related to your immune system potentially attacking, and that's a whole different conversation for a whole different day. But this paper actually concludes that mercury, which is an environmental neurotoxin, that's what it's known for as per CDC, is commonly acquired by ingestion of methyl mercury in seafood, and that a significant number of patients with idiopathic neuropathy have increased mercury levels in their blood. So this is, one of the reasons why we test for this in all of our neuropathy patients. Another paper that you can find on PubMed, chronic inorganic mercury-induced peripheral neuropathy. So one of the things that we do with our patients is we run what's called a Mercury Tri Test. That's one of the most comprehensive mercury tests out there. We take a blood sample, a hair sample, and a urine sample, and we want to compare how much is circulating in the bloodstream, and are patients actually able to excrete it properly and effectively through urine and through their hair. But it also measures, which is a very nice feature of this test, the methyl organic mercury amounts and the inorganic amounts, so we can get a better handle on where this person is getting into trouble and getting exposed. Are they likely eating too much fish? Do they have a tremendous number of fillings? Did they just get metal fillings out and then got exposed in that process? And that's most likely what's going on. And then the total amount here. So there is a way for us to test to see if you have mercury in different forms. And then there's a way for us to see if you're urinating it out, or getting rid of it through hair, or if you're also dealing with stress on those organic levels as well. So a little information to just help you understand the importance, if you have neuropathy, of getting very comprehensively worked up, especially for heavy metals, so that we can determine if that is a contributing factor or part of the reason why you have neuropathy in the first place, which will then help guide what protocols that we do with a patient to help eliminate the mercury with chelation protocols in the office. So I hope you found that information helpful, and stay tuned for some more videos that we're going to be doing specifically on neuropathy and metals and some of the different causes. So have a great day.